it's Dr. Nancy coming to you live on Wednesday. Today we have a very special guest, Jennifer Whitlow. She's a music, what do you call yourself? Therapist?
Yep, I am a music therapist.
Therapist, okay, that's what I thought. Which is interesting because I don't know a whole lot about music therapy, so I'm really anxious to hear what you do. So how about if you just give us a little background, how you got into this, and then tell us a little bit about music therapy.
Okay, so I'll just kind of start how I stumbled upon music therapy. So I actually was going to school first for music education and double majoring in music education and psychology. And it was my 5th year in college. I was taking abnormal psychology and learned about music therapy as a profession. So so after doing some research, I was going to Indiana State at the time. I saw that St. Mary of the Woods had a music therapy program. So I went ahead and graduated with my music degree, didn't student teach, and went over to St. Mary of the Woods, finished my psychology degree, and also got another bachelor's in music therapy. So I have a very healthy collection of bachelor's degrees. And I practice now music therapy. So as a board certified music therapist, it is a 4-year bachelor's degree. And then we do sit for a internship. And so we have a clinical internship. It's usually roughly about 6 months long. Some kind of give or take. It's I think 1080 or 1040 hours is what they need to complete for the internship. And then you sit for your board certification and become a board certified music therapist.
I had no idea. This is great.
Yeah.
What does a music therapist do?
So, I mean, there are music therapists working in so many different places across the country. So there's music therapists working full-time in hospitals and school settings and private practices. There's juvenile detention centers. Really, there's a huge in mental health. There's a lot a music therapist could do. So kind of the broad definition of what a music therapist does is we work with a client in a therapeutic relationship where we would work and assess their strengths and their areas of needs based on kind of what we would see fit. And we would use music to facilitate a non-musical skill. So we would be working on like a communication goal or maybe like to decrease pain or perception of pain, to decrease anxiety or stress. And we would make it a measurable objective that we would then use music to work towards.
So do you set like certain types of music to certain problems, or how does that work? Certain rhythms?
Sure. So there's actually some studies about entrainment and rhythms. So using rhythm, even just like in terms of speech. So music therapy got a lot of publicity when Congresswoman Gabrielle Gifford received music therapy and her treatment for her brain injury from when she was shot. And a lot of what they would use is rhythm for speech. So it's a branch of music therapy called neurologic music therapy that talks about the use of rhythm to work on specifically brain impairments. So yes, rhythm is a part of it, but it's not just necessarily rhythm. Even just working on, so let's say that we're working on a client with fine motor skills, even just grasping a mallet is working on those same muscle movements as working to grab a utensil, to write, or to, whatever it is that we're wanting to do. So, a child might have a lot more fun grabbing a mallet, crossing their midline, and hitting a drum. But it's still working on that same motor functioning that, like, say, a physical therapist might, or, an occupational therapist or whomever would be working on that similar goal. So
it's not like listening to AC/DC and hitting the note like that.
No, exactly. So it's not necessarily about just, playing music or being live in the music. It's all the spectrum of using music. So it can be listening to music, it can be singing, it can be playing instruments along with it. It's improvisation. So free form music, creating your own music for self-expression, songwriting. So there's a lot that really kind of comes into what we do as music therapists. And so it's really any modality of how music's used.
Very interesting. So what do you see? I saw, do you do stuff with pregnant women too?
We do. So it's new. So working with pregnant women is new to our our business. And so our business has been in the Indianapolis area for 4 years. And so I recently did donut training, and then also have done music therapy assisted childbirth training. And I've taken a couple other perinatal music therapy courses to begin working with moms in the perinatal spectrum. So I'm wanting to work. So I have actually assisted a couple moms in childbirth using music. And I really have a strong passion of wanting to work with them in postpartum, especially with with any sort of, postpartum depression, anxiety, using music, even prenatal, in conceiving process too, working on distressing, things like that. And then also working with them with moms and babies. And so so that's kind of, I wouldn't say it's brand new to our business, but it is something that we're looking into expanding more within our business.
Very interesting. I had no idea. This is so fascinating to me.
Yeah.
So what about like babies? Infants, anything you can do with infants with music therapy?
Sure. So I am not a NICU certified music therapist, but I will tell you that there is a ton of research that supports using music with babies in the NICU. And I will say that even with babies in the NICU, like the top NICU programs across the United States all have music therapists. And when when babies in NICUs are being seen by music therapy, or a lot of music therapists. And so I know here in town, Riley Children's Hospital has music therapists in their NICU. And then also in St. Vincent, I believe they have a music therapist as well. But we do work with babies once they're out of the hospital setting. And we're working on with the babies and the moms to work on bonding, exposure to music. I mean, just like reading, that exposure to that language. There's been research that shows like engaging in music activity increase bond between like the mom, the baby, and family members. So encouraging people to bring music into their homes to be able to work with to encourage their kids to kind of grow. There's also a lot of research that supports like increased vocabulary and literacy skills for early exposure into music with young children. Also working on those developmental skills by instrument manipulation, grabbing instruments, that moving around, and just that whole experience. So there is a ton of research that does support early exposure to music is beneficial to young children.
Very interesting. I could definitely see neurologically how that would work, especially using your hands and stomping your feet, things like that,
Absolutely.
Rewiring, things like that. So you probably work with a lot of ADHD kids, behavior issues, things like that too, or?
Absolutely. Our biggest population is autism. And so we work with a ton of individuals with autism. So with my company, we're really birth to kind of end of life. We work with a very wide range. But I would say that most of our clients are probably fall in between even 5 and 20. It's kind of the bulk of the individuals we work with, and usually with diagnoses of autism, cerebral palsy, Down syndrome, or some sort of a neurologic delay. That would be kind of associated with one of those diagnoses.
I'm going to put you on the spot here. Do you have any success stories, or do you have a neat story of a client you've worked on with music therapy that kind of touched you, or?
Yeah. So I always tell people this is not always something like that we would necessarily promise to families. But so I worked with a little boy. I started with him when he was about 3. And when I started working with him, he probably had maybe you could say 5 or 6 different words, very low vocabulary. And after I started working with him, it didn't take long for him to start wanting to sing songs. And so maybe after about a month and a half of working with him, he could sing all of Row, Row, Row Your Boat, and would sing it. His mom was like, I love it, but hate it all at the same time. And she's like, because if I have to listen to Row, Row, Row Your Boat one more time. And she's like, but she had spent 3 years not hearing her son talk very much. And so then he just would sing constantly, Row, Row, Row Your Boat. But now he talks and talks and talks and talks. And so many different words, but really at being 3, he really didn't have much that he would say. And so, that, and then Oh my gosh, I have so many clients. I have so many success stories to share. But even I worked with an older adult who, when I first started with him, he wouldn't even stay in the same room as me. And a lot of the times when he would come into the room, like he would he broke the television once during one of our sessions, like would just be, I mean, pretty kind of aggressive and stuff. And it got to a point where our goal changed from staying in the room to, increasing attention and how long is he going to stay in the room with me? How long is our session going to be? And I've worked with this individual within my company. So me or another music therapist has worked with him for over 5 years. And you would have no idea that that was the start of the music therapy journey for him. Yeah, so I mean, so many, it's evidence-based. In our practice, we take data, so we can really kind of see. Sometimes as a therapist, it's hard to see all of the things that we're necessarily working on when we're day in, day out, but it's really cool for me as the business owner within my practice, to work with some of the clients that I haven't seen in a while and come back and observe my team working with them. And I'm just like, oh my gosh, like this is a totally different person than when I saw them, 6 months ago or a year ago or 2 years ago. And it is like it's really cool to see all the progress that all of our clients are making.
Very interesting. What is the website for your business? And I'll put that up here.
So it is dynamicmusictherapy.com.
And it's a private practice?
Yep. So I'm the owner of it. I opened it about 4 years ago, and we have 9 full-time music therapists, and then I make 10. So,
oh my gosh.
Yeah. So I'm full-time in my business, but I'm not full-time doing services. So
where's your practice located?
So we don't have a brick and mortar at this time. We're hoping to have a space of our own here soon, but we are Indianapolis and all of the surrounding counties. So we are in every county around. Yeah.
You go to people's homes then, or like a center, or?
Both. So we have some partnerships with some ABA facilities where we see some of their clients while they're there, some D programs. We go into some nursing homes. We go, really kind of anywhere. So we've got some good partnerships around the community. And we offer classes where, mommy and me style classes where moms and babies can go to. And then we primarily do private practice in clients' homes. So.
Okay, wonderful. Yeah. Well, I tell you, that is some really great information that you shared today. I'm definitely going to look into this a little bit more. I know we have a lot of people that could benefit from it, and who doesn't love music, or beating a drum or
right. I just had an incredible experience too working with a mom. Do you want me to share kind of how you use music in their births, some of their births?
Yes, please.
Yeah. So with pregnant moms, there's been research that supports that with the use of music therapy, it can decrease the perception of pain, anxiety, and fear for moms, and anxiety and stress within their birth. So as music therapists, we use music, and the way that I've worked with some of the moms, I've given them some playlists that are already preset up for them to listen to, some different playlists that they might want to use within their births. And then during their births, we might change the music to help with them. So for instance, I had a mom who was like laying on the birthing ball, and she was like super relaxed and, really kind of knew she needed to get up and couldn't really stay in that position for forever. It's good for moms to be moving during birth and stuff when they can. Right. And so even using the music to kind of support her in that relaxation, and then picking the next song to start increasing that tempo to get her body kind of back moving into where she needs to go at a gradual pace, instead of even, going just, standing up, being relaxed to this new place. It was a very gradual thing for her to where she could kind of go with it, and her body could continue to entrain with the music, and her body could continue to kind of do what it needed to do, gradually, instead of you're here, now you're here.
Right. That makes sense.
Yeah.
Yeah. And so you already know ahead of time kind of how to set the tempo and things like that, what, song suggestions to give her and things like that. Yeah.
Yep. And so I meet with the families, talk to them. And tempo is a big thing that comes into it, making sure like even just how much like how many instruments are into it, like making sure that it's not, too overstimulating for mom and for baby. And just really making sure like the key is an appropriate key for that time and kind of what's going into it. So there's so much musical elements that go into when we pick music to go into the births, and what really works for moms. And there's been a lot of research done that can show that too.
That's interesting. Now, on a side note, music therapists, would you have to have hospital privileges to go work with a client in the hospital, or are you allowed to go in to help if somebody's birthing in a hospital?
If someone is birthing in a hospital, they're absolutely allowed to bring in whomever they want. So we would act. So I've always kind of struggled with what we would title ourselves in that. I mean, we would be acting kind of as a doula and a music therapist. And so in the music therapy assisted childbirth training, it does go into a little bit of, the doula scope. I can operate with both scopes because of the fact that I've done DONA training and I'm a music therapist. So, I get to be both anytime I walk into a hospital. So I can say I'm a doula, I can say I'm a music therapist. And so I have a couple of team members who have done music therapy assisted childbirth, and they kind of, back me and want to do like a little bit more in births and things. And they're kind of just getting their toes wet a little bit. But I've really considered having them do DONA training as well. So that way we're, really providing that service. So we would be really acting as that. But there are music therapists. There's research that has had music therapists actually doing music therapy prior to cesarean births to decrease anxiety and stress in mothers prior to a cesarean. So I would imagine that in those studies, those music therapists probably do have privileges in the hospital and probably are employed with the hospital, but I'm not sure because I don't have all of that from the research.
Right.
Yeah.
Well, that's good to know. I think it seems like birthing is kind of your passion.
It is. It is. Yeah, it's been good for me to move into this direction, and I really feel it's new for me. I've been a music therapist for 7 years, and this is a new population for me to be working with. But at the same time, I really do feel very drawn to it. So
it is. It's very fulfilling working with pregnant moms and childbirth and little babies.
Absolutely.
Well, Jennifer, I really appreciate you coming on today and talking with us. Do you have any tips or anything you want to share with our moms?
Yeah, I would say just, sing to your babies, nurture your children. And, singing also it's therapeutic for you as well. It can increase endorphins. It's one of the things that they can say really can help moms in general. So sing to your babies. It's a benefit for you. It's a benefit for your child. And they don't care how bad your voice may or may not be. You care way more than them. They want to hear your voice, not mine, not Dr. Nancy's. They want yours.
That's
so
right.
Sing and sing some more.
Wonderful. Well, thank you again for joining us today. And if anybody watching has any interest in finding out about Jennifer's services, we have the website posted up here. We'll post it in the comments too. It's easier to see sometimes that way. And if you know somebody that might benefit from music therapy, share this video and tag them and have them contact Jennifer. So Thanks again, Jennifer. I really appreciate you coming on.
Yeah, thank you so much for having me.
All right, have a great day.
You too. Thanks.
Bye.